I am Community Chloe of Radio 1 Richmond stations, and I am truly honored to be a part of Her Story RVA, which is a virtual women's empowerment series curated with Black women in mind. This episode is sponsored by Virginia Prenatal Perinatal Collaborative. Now, we're here tonight. Of course, with the Virginia Maternal Quality Care Alliance. Now, this evening, we will be discussing Black maternal mental health. We'll also discuss the maternal mental health conditions and impact it causes in Black women. From dismissed medical needs to birthing complications, Black women are more likely to experience traumatic births and the mental health consequences that flow. Tonight, join me with founder and executive director of Urban Baby Beginnings, Stephanie Spencer, as she continues to share resources and connect with us about the Maternal Quality Care Alliance. Hi, Stephanie.
Hello, how are you doing? Thanks for having me.
So tell folks a little bit about you.
Sure. So I am a mother of three, executive director and founder of Urban Baby Beginnings, as you mentioned. And I also am very, very interested in building stronger health systems and also community-based supports. And so my work really spans in at the state level, working with the Maternal Quality Care Alliance, which is why we want to share information about what's going on today with our community.
Stephanie, you're doing a great job.
Thank you.
I'm also excited to introduce two very special guests that are joining us tonight as well. Please welcome Amanda Wheeler, who is licensed clinical social worker. Hi, Amanda.
Hi, how are you?
I'm good. Tell us about you.
Thank you for having me today. Absolutely. So, as you mentioned, I'm licensed clinical social worker. I really got my start in home visiting, working with this population. At Healthy Families is where I kind of got my start working with young families, prenatal moms and young families. And then over years, had gone over to Child Development Resources and continued home visiting work. And that's where I was able to get a little bit more exposure to the postpartum population through Postpartum Support Virginia. I was able to get trained in PMADS, which is the perinatal mood and anxiety disorders, and really just took a lot of interest in that population, and helped me to understand even more about myself as a mom and some of my own experiences. So really just kind of drew me into this work. And so now a licensed clinical social worker practicing as a clinician and working primarily with that population.
Wow. Amanda, thank you so much for joining us tonight. And Candace Burrow is the Community Transformers Foundation Mommy Connect founder and an advocate for Black maternal health. And of course, a mommy herself. Candace, welcome and tell us about you.
Hi, thanks for having me. As you said, I'm Candace. I am the founder and program director for Mommy Connect, which is a program that is a part of Community Transformers Foundation. I'm super excited to be a part of this discussion tonight on maternal mental health and Black women and the importance of both recognizing that there is a mental health crisis and getting treatment. I am a single mommy to a beautiful 8-year-old girl, and I have had my challenges dealing with postpartum depression and anxiety over the last few years since becoming a mom. And I can't wait to share my story with everyone and bring awareness to the daily struggles of single parenthood, mental health, and suicide prevention.
Candace, thank you so much for being here. Stephanie, we're going to start with you, and this is going to be a question open to all of our panelists. We are here tonight to discuss the importance of maternal mental health in Black women. In your own words, what is maternal mental health and why is it important to today's society?
Sure. I mean, everything starts with our mental and physical health and well-being. And, to me, mental health means, really looking at the spiritual, holistic aspects of care and the supports that you need to be as healthy and as happy as possible. And it's extremely important also because when we aren't healthy, whether it be mentally or physically, it is very hard to pour into other people, such as our children, our communities, our works, on down the line, whatever is important to us. And so when we're bringing this up in the Black community, what we're really talking about is elevating an issue that is affecting many, many people, especially post-COVID. and helping people to really recognize the signs and symptoms and how to respond. Because I think a lot of times we don't know how to respond to individuals who are having mental health crisis. So it's an important issue, and we hope that people today will be able to learn more about it and even learn more about themselves.
It's such a blessing that we're opening up when it comes to Black women of color to talk about mental health as it relates to a mother. Because, with the old wives' tales and back in the day, it was your baby and you had to deal with it, right? Regardless of how you felt, you had to take care of your baby. And your mental health was a sign of weakness back in the day. Do we agree on that? Y'all can
Absolutely, for
relate and
sure.
relate that. So,
Absolutely.
Amanda, I want to ask you the same question. Maternal mental health. Why is it so important to today's society?
It's so important. I think we spend a lot of time focused on what we're doing, where we're going, how we look, how we present, what happens to us. And we forget to kind of just pause and focus on how we feel through all of that. So I think mental health really is, how are you feeling? Checking in on yourself, just slowing down for a moment, and kind of examining how a situation affected you. And being able to really identify with feelings of embarrassment or jealousy, or those are harder feelings to connect with. We feel like we shouldn't have them, but they're there and they're in the background. And I really think that this discussion just kind of brings to the forefront not just what we're doing, where we're going, where we work, how we look, but how we feel in the process. And I really think that those feelings impact our core beliefs about people, about ourselves. And so then that impacts how we behave. So I'm all about the cognitive behavioral approach. How we
Of
feel
course,
affects what we
I
do.
did.
It's coming out.
It is coming out.
But it's absolutely present, and it's
Yeah.
present every day. And so this is just us acknowledging the presence,
Mhm.
but it's always been there. And so I'm so glad that these conversations are opening up and becoming more normal.
Yeah. Normal conversations.
Mhm.
And we all don't mommy or mother it the same. It's all different for us. Now, Candace, I want you to tap on that just a little bit because I have another big question for you. So, why is Black maternal mental health important in today's society?
Um, it's important in today's society because, as both ladies said, it definitely affects the world around us, such as our jobs, our homes, our kids, our ability to be great mothers. And we also need to be able to come together as a community to recognize, the signs of the maternal mental health so that we can support each other and those around us that are experiencing these conditions.
Candace Barrow, thank you. Now, for your next question. Maternal mental health conditions such as depression, anxiety, and substance use disorder are the most prominent complications of pregnancy, childbirth, and postpartum, affecting 1 in 5 women. According to the CDC, 1 in 8 women experience postpartum depression. As the founder of Community Transformers Foundation's Mommy Connect, can you expand on what this organization is, your organization is, and why did it get started?
Yes, absolutely. So Mommy Connect is a program, a part of Community Transformers Foundation, which is a 501c3 nonprofit organization that addresses the social determinants of health, such as food insecurity, mental health and wellness, and equality in underserved and underrepresented communities. Mommy Connect was put into place to support those women in those marginalized communities who battle with depression, anxiety, and the single stresses of parenthood, like myself, come together to figure out ways to cope and overcome these obstacles, all while creating or building on a support system for those who don't have one, and a forever sisterhood. The program itself is broken down into 8 weeks of curriculum-based sessions led by a team of trained mental health professionals. Each session provides women with different coping mechanisms, local and or natural resources, along with educating them on the importance of healthier lifestyles for both mom and the child.
So, Candace, in other words, it's a holistic approach.
Absolutely.
Thank you so much for sharing. Okay, let us get back to this licensed clinical social worker. She's going to bring it on. Amanda, can you touch on this as well? What are some of your experiences with Black women dealing with maternal mental health as a licensed clinical social worker?
Absolutely. I will say that in my experience, because a lot of Black women don't necessarily come from a background where mental health is discussed in that way, it's harder for them to access that education and that knowledge even about themselves. That's just kind of not the background. And sometimes certain behaviors can be seen as angry when it's really anxiety, and you don't get treatment for anger, or you don't get the compassion for anger, but you will for anxiety. And so just finding the words and the language to use to really express how you're feeling is what I'm seeing might be lacking sometimes in the Black woman population. And so as we educate ourselves and as I educate the clients that I work with about using the language that they need to express how they're feeling, I see some of those barriers coming down. I think oftentimes Black women may have less time and opportunities to address their mental health needs. Tend to be caretakers of children, caretakers of their own parents, caretakers of other members of the family, young cousins and neighbors, and sometimes may take on too much, because they're in position they're viewed as helpful and resourceful, and they have that, but not attending to their own mental health. Like I said, there's a lot of doing and not a lot of stopping and reflecting and just kind of really managing those, or even noticing those symptoms and then managing them. So those are some of the things that I've seen. In addition, I've also noticed that most Black women that have come to me for clinical help were looking for a provider of color. And so they have probably had more experiences, especially with medical providers who are not Black, or a woman. So they're specifically looking for a Black female therapist because they're feeling that potentially there's a connection that could be made. There's a shared experience there. Or at least lack of judgment, a judgmental attitude is what they're expecting. So that's certainly something that's come up. Oftentimes, and I suppose with any group, but with Black women, there might be a history of trauma in dealing with systems and providers from other backgrounds. And so they're more likely to hesitate before getting into an intimate relationship, like a therapeutic relationship with someone who doesn't have what they perceive as a shared background.
Yeah, cultural sensitivity and competency.
Mhm.
Amanda, thank you so much for that. Stephanie, founder and executive director of Urban Baby Beginnings. Cultural barriers and lack of representation in the mental health field continues to limit Black women from seeking help. Can you share some statistics and information about the amount of women that are impacted by maternal mental health conditions that remain untreated?
I think that when we were really looking at the statistics, and Amanda, correct me or catch me in this when I'm talking about it, I do believe that there's a large percentage of individuals who are not treated or even identified to be treated in this particular space. And the reason why, and I think when I look at the numbers or I think about the numbers, what I realize too is that a large part of it is because many Black women are not being screened for mental health disorders regularly. Would you say the same, Amanda?
Absolutely. Yes.
And so when we are talking about that 1 in 4 or 1 in 5 or 1 in 8 individuals, I would say, and I don't want to guess on this one, so you're going to have to correct me if I'm wrong, but I would definitely say that when I've worked with many of the moms in the community, that when we're talking about the screenings that they have had, that they are having at least a screening every trimester during the pregnancy and at least one in the postpartum period. But other than that, there are no other screenings that are taking place. And, from a physician standpoint, or at least, me being a registered nurse, what I know is that we don't necessarily have all of the opportunities to be able to do those screenings because individuals need to present into systems of care in order to get a screening completed. And as Amanda stated, when there is a huge barrier and trust barrier that keeps Black women and Black communities out of the systems that they may have to engage in to get connected to care. So I believe that that statistic is very hidden as well. I don't think that we have a good grasp on the number of people who really truly need treatment and aren't getting that treatment.
Mhm. Thank you so much for sharing, Stephanie. Black women not only face a higher chance of developing perinatal mood disorders than white women, but they are also less likely to receive treatment, as you mentioned, due to factors such as fear of stigma, involvement of child welfare services, and financial barriers. Amanda, what advice do you have for women that are currently going through this, the fear of stigma?
Absolutely. To keep advocating for yourself, keep looking until you find the help that you need. It is so hard. And every time I work with a client, um, my the initial comment is it was so hard to finally find you. Especially if you're in the midst of depression or panic or anxiety or trauma, it's so hard to keep pushing forward. But that's my advice, to keep pushing forward until you find that good fit. It's there. The help is out there. And also to bring your family and your close friends, your close support systems in on what's going on with you. Talk about those things. You'd be surprised at how much similarity there is between other mothers, other people who've gone before you who might be experiencing similar symptoms. So we have to open those conversations and normalize and use the right language. Yes, I'm feeling anxious. It's okay. There's a treatment for that. And just really kind of understanding, educating yourself on what you're experiencing. I didn't know there was a perinatal OCD disorder. I didn't know that was a thing until in later years. I wish I'd known that sooner. Or birth trauma, and just really kind of honing in. Yes, if your baby was taken from you at birth and airlifted to another hospital, that's a trauma. It probably is a trauma for you. So just really being able to speak up for yourself, advocate for yourself, including your family, and then finding those resources out there that are free or that have grants attached to them. Postpartum Support Virginia has a grant specifically to help get therapeutic support for moms of color. So to keep looking for those. Child Development Resources has a mothers and babies group. And the groups are so nice. Find a group. They're so nice because you're hearing from other people who are in it at the same time as you. And that part is so important. You can talk about sleep deprivation together. You could talk about co-parenting together. You can talk about breastfeeding and bottle feeding and the challenges of that together. So finding a group. Absolutely. And finding those free resources. They're out there.
Mhm. Amanda, I thank you so much for sharing, Stephanie and Candace, for being here this evening. And Amanda, really quick, back to you. Yes, pregnancy, postpartum, we all experience it differently. And so at this point in our lives, when someone tells you they don't feel right, I think, and you let me know, don't tell them that it's going to be okay. Right? Can
Mm-hmm,
we
mm-hmm.
agree on that? It's okay. I've had a baby. It's okay.
Right.
Because your issue may not be my issue, and I've made it through, but this other person could take their life.
Absolutely. And I'm glad you brought that up.
Yeah.
Absolutely. We don't want to minimize or brush to the side or go
Yeah.
past real fast. You're exactly right. One person's experience is not necessarily
Yeah.
the same as another person's experience.
Mhm.
And we got to be in it with them. Like I understand where you are. It's and how you feel is acceptable. We can sit here for a while before we move on to it'll be all right. So
Right.
absolutely, I'm so glad you said that because a lot of times we want to just fix things. We want people to feel better, and they're not there yet, and that's okay.
Yeah.
So
So that's why we're all here together.
that's why we're here.
So thankful with you guys. All right, Candace Barrow, as a mommy, can you expand on your own experiences with Black maternal mental health? What resources and services did you utilize?
Yes, absolutely. It has been a journey, I will say. When I found out I was pregnant in 2015, I literally thought my life was over. I had been out of school, out of undergrad for about 2 years. And I had plans during that moment to travel abroad to study film to get my master's degree. But of course, all of that got pushed back because I was pregnant. I didn't know what to expect. And I honestly believe that is the moment where my depression started. I wasn't ready to become a mother, let alone a single mother. I was raised in a household with two parents, and I knew no other lifestyle than that. So during that time, I suffered from guilt, shame, and like the fear of letting my parents down because they had tried so hard to keep me on that right path to success and from making poor decisions. And they wanted me to be married and be in my career before having a baby. And at that moment in time, probably still today, I am a daddy's girl. So knowing that me being pregnant and, him no longer seeing that innocence in his little girl would hurt him, that alone made me extremely sad and put me in a very dark place because I never wanted to break his heart. So, around 2017, I'll never forget, I had literally reached my breaking point. I was in between jobs, receiving Medicaid and food stamps for both myself and my daughter. I didn't have money for diapers. I wasn't getting child support. I couldn't afford my car note. I was behind on everything. And at that moment, of course, I didn't want to ask my parents for anything because I had already felt like I was a disappointment. I just remember driving home from the grocery store and literally breaking down in tears, thinking that, I wanted to end my life. Like I didn't want to be here anymore because I was so overwhelmed with just emotions and just my mind literally taking over. My just the whole experience of being a single mother and not wanting to and not being able to afford the things that I felt like I should have been able to afford during that time. As a parent, it really took a toll on me. I ended up going to my mom's house and falling to my knees, like hysterically crying and letting her know, like, I don't want to be here anymore. Like, I don't want to live. Like, I'm ready to go because I felt like at that time, my daughter would be in a much better position, and that there would be somebody else that could take care of her better than I could. Um, and at that moment, my mom called my dad and she didn't know what to do. And they had never experienced it. And he told her to take me to the hospital. So we ended up going. And at that moment, I ended up getting, well, after like treatment and all of that, and them like monitoring me, blood pressure, um, I ended up getting involuntarily committed, and I spent about a week in a mental health facility undergoing psychiatric treatment. Um, During that point, I did find my own personal relationship with God, and I learned exactly who He is and how He was changing my life. I also began to see things from a perspective of which I couldn't see before then, which was my support system. My parents pretty much stepped in and took care of my baby, while I was away. And I realized that my fear of not having support and losing my child to social services because I seeked help no longer mattered because I honestly had a great support system. And for that, I am forever grateful because they actually helped me get to the point of where I am today in a better headspace. And realizing that my health, is priority because my daughter is priority and she needs me just as much as I need her. And I recognize that, not all women have that support system that I have, which is where Mommy Connect actually came for those who don't have it and letting them know that they don't have to go through it alone.
Candace, oh my goodness, thank you so much for sharing with us. You had the support system there the whole time, but you were feeling embarrassed. You felt like you weren't daddy's little girl anymore. And can you imagine countless others are watching this who feel that way? They could just simply pick up a phone, go to their parents' houses, and just fall at their knees and get the work. Because a lot of times when you're going through, we don't know if you don't share.
Right.
So, Candace, thank you so much for that. Now,
Okay.
Stephanie, can you touch on the risk factors for perinatal depression? What resources and services does UBB MQCA provide for women facing the challenge of maternal mental health?
Sure, absolutely. And first, Candace, first, thank
Yeah,
you for sharing such
yeah,
an important story,
absolutely.
because I think that many of the families that we work with don't get an opportunity to hear from their community members about what's truly going on. And it takes a lot of bravery to be able to share. I'm always brought to be humbled in this space when I hear you speak. With that being said, there are a lot of resources for maternal mental health that are underutilized. One of those I just want to remind people is that if you are in crisis or you feel like you need mental health supports, that the federal government has a phone number, and it will be shown on this segment, where you can call, and it's a 24/7 line where you can get connected with maternal mental health providers, along with peer specialists who can provide support, encouragement, and connections. Um, there are risks, obviously, for individuals in the maternal mental health space when they are pregnant or postpartum. Those who are more isolated tend to have more mental health related issues. As Candace mentioned, she has a great support system. But imagine not having that, or having sporadic supports. And so we're always encouraging communities to work together to support families, because we need to bring that back in our communities. There is a risk factor for those who have gone untreated. I think 75% of women of color tend to not be treated for their maternal mental health conditions. That's a lot of folks, and that's prior to pregnancy too. So you've got to be thinking that if you're having mental health issues prior to pregnancy and you enter into pregnancy, you're more at risk for having issues. And I also talk about, just from a risk perspective, that we always want to contextualize what's really happening, because yes, there are sometimes chemical imbalances and things like that that can cause people to have extreme thoughts. But also, just in general, when people are, and especially our Black communities, who are so stressed, so overwhelmed, living in environments that may, feel where we might feel threatened in other aspects. When we contextualize it and we realize that, also, when we don't have access to certain things, when we don't have strong community supports, things like that, that can also place us at risk for having mental health issues, and also at risk in the maternal mental health space. So, with that being said, the federal number that I provided is one resource. Also, Postpartum Support Virginia, which we are going to provide that information, which is a resource not only to connect to their warm line, which has peer support specialists that can call. There are support groups through that group, and Mommy Connects, which also has a group as well that works with mothers. And these are all programs that are available and accessible statewide. And the federal program, obviously, is a federal program. We have been doing a lot of work at the MQCA to encourage partners to come together to talk about maternal mental health and encourage safer systems of support, meaning that regardless of where you go, you should be able to connect with someone in a resource. People should know what to do if you are not doing well. And not only from the perspective of where it's extreme, but also when you're just not doing well. And so we encourage people always, especially in the maternal mental health space, if you are having challenges, to please connect. You can connect with Urban Baby Beginnings. Any of our partners at Maternal Quality Care Alliance will have a new website coming up soon, where you'll be able to use that website for resources. Even if you can't remember what we said, going to our website will help you as well. And then also, don't discount the supports that your providers can give you to connect, because sometimes that screening, that connection to care, and the things that need to happen also need to be done at the provider level. And as Amanda said, find that provider that you trust, that you can relate to, that can help you to get the care and resources that you need. And don't do that in fear.
Thank you, Stephanie. A lot of great information has been shared this evening. Amanda Wheeler, a licensed clinical social worker, and Candace Barrow of Mommy Connect with Community Transformers. Again, thank you so much for joining us. A lot of great information shared here tonight. I want to thank our sponsor, Virginia Neonatal Perinatal Collaborative and Maternal Quality Care Alliance. And again, Thank you, thank you, thank you to our panelists. We want to thank our viewers for watching. All of the information you need is posted on our screen. I am Community Club. Thanks for watching.